Hello viewers, welcome to my YouTube channel. Kindly like, share and subscribe my YouTube channel. Today we are going to see about the physiology of the menopause. To know the physiology of the menopause, we should know about the hormonal regulation, normal hormonal regulation. So, uh, hypothalamus is the one which secretes the hormones. Hypothalamus secretes the gonadotropin releasing hormone which further acts on the anterior pituitary gland, and anterior pituitary gland releases FSH and LH into the ovaries and helps in the maturation of the ovaries. And Graphene follicle and the primordial follicle releases the estrogens. Carpus luteum releases the small amount of estrogens and large amount of progesterone. This is the positive feedback mechanism of the hormonal regulation during the menstrual cycle. To know the menopause, we should know about the normal menstrual cycle and the hormonal regulation during the normal menstrual cycle. Next, we are going to study about the definition of the menopause. Menopause is defined as the period when permanent cessation of menstruation takes place. Normally, it occurs around the age of 45 to 55 years. So, in some women, the menstruation stops suddenly, and in others, the menstrual flow decreases gradually and then finally stops. And in some women, there may be irregular menstruation and then the flow may stop. These are the various scenarios how menopause occurs in different women. Next, what are the causes of the menopause? It may be the ovarectomy, hysterectomy, and cigarette smoking, atrophy of the ovaries, decreased secretions of the ovarian hormones. So, what are the physiological changes during the menopause? We can see is in the female reproductive system, around 45 years, only few primordial follicles remain in the ovary, which are stimulated by the FSH and LH. The role of FSH and LH is the maturation of the uh, graphene follicle, corpus luteum is formed. Maturation of the follicles is done by the FSH and LH. So, if the primordial follicles are reduced, what happens? There will be the less production of the estrogen. And if the primordial follicles are atrophied, then also there is a less production of the estrogen. So in total, if there is a less production of estrogen, there is a cessation of the menstrual cycle. Hence, the menopause occurs. And now we are going to see about the postmenopausal syndrome. The postmenopausal syndrome is a group of symptoms that appear in the woman immediately after menopause. Syndrome is nothing but a group of symptoms or disease. Postmenopausal syndrome is a group of symptoms that appear in a woman immediately after the menopause. Due to the hormonal changes, there are some of the particular menopausal syndromes that occurs in the female. So, what are that? What are its causes? What are the symptoms? We are going to study here. So the causes are lack of estrogen and progesterone. As we have seen, primordial follicle also secretes the estrogen, and due to the atrophied primordial follicles, there may be the decrease in the estrogen secretions. So the postmenopausal syndrome may occur. Symptoms may persist till the body gets adjusted to the absence of estrogen and progesterone. The symptoms of post-menopausal syndrome, it doesn't appear in all the women. Some may develop mild symptoms, some may develop severe symptoms. It may last for few months to few years. And what are the main symptoms seen when it is developed is hot flushes, which are characterized by extreme flushing of the skin. Hot flushes start with discomfortness in the abdomen and chills, followed by feeling of heat spreading towards the head. Then face becomes red, followed by sweating and exhaustion. This is the main feature seen if the symptoms are severe. And vasomotor instability, wide fluctuation in the BP may be present. BP may increase suddenly, it comes back to the normal automatically. And next symptom is fatigue, nervousness, emotional outbursts like crying, anger, mental depression, insomnia, palpitation, vertigo, headache, numbness or tingling sensation, urinary disturbances such as increased frequency of micturition, osteoporosis and atherosclerosis. Osteoporosis is seen mainly after the menopause in the women. So it is a major marked symptom seen in the female. What are the treatments is hormonal replacement therapy is a main treatment given during this phase. Most of the women can manage it very well, but in some cases some of them need the psychotherapy. If it fails, then hormone replacement therapy is given. Daily administration of estrogen in small quantities will reverse the symptoms. Hormonal replacement therapy consists of combination of estrogen and progesterone is more advantageous, because if we give only estrogen, there may be a chances of estrogen induced cancer and hyperplasia of the myometrium. So we are going to give the combined combination of estrogen and progesterone. And hyperplasia of myometrium is the middle layer of the uterine cavity. That is, the layers of uterine cavity are three. So outer layer is perimetrium, and the middle layer is myometrium, and the inner layer is endometrium. So if we give only estrogen hormone, uh, the symptoms may be worsen, and the estrogen induced cancer may be present, may be occurring, and hyperplasia of the myometrium may be occurring. So for the safer side, the combination of estrogen and progesterone is given to balance. And hyperplasia of dose should be gradually reduced to prevent reoccurrence of the postmenopausal symptoms. So dose should be gradually reduced and prevented. World Menopause Day is celebrated on the October 18th. So here is the end of the slide. Thank you. Kindly like, share and subscribe my YouTube channel. Thank you.